today we're going to be talking about how to make a CPAP device for patients of the COVID-19 virus to hopefully help keep them out of the hospital. So we have some 3/4 inch by 1 inch fittings from the hardware store, some 3/4 inch by 3/4 inch threaded fittings, and some hose adapters. We have a painting respirator. This is from MSA, but there's lots of models out there. These are from hoses from CPAP machines. We can also use a dishwasher drain hose. This is a bubbler that I've already created out of PVC pipe. Should be pretty clear how that's all put together. Okay, so the first thing I did is I already cleaned out my mask here. And what I'm going to do is I'm going to hot glue in some of these PVC pipe fittings that will allow me to let air into and out of the mask. So, hold on a sec. So what I'm going to do is put some hot glue on this edge here, put some hot glue on this in here, and stick it all together. So let's see how it goes. You don't want to get any hot glue inside that little hole because that's where the sealing features are. And we got to do this quickly before it all congeals. Okay, I'm going to put some extra hot glue on it. So we want to get a pretty good joint there. Okay. So now let's get that's the inlet to the mask. Now let's get the outlet going here. Okay. So we're going to reinforce this one with electrical tape when we're done because the hot glue joint is not that big. Okay. So now you can see the mask is all configured. You have to wait a few minutes for it to dry. Okay, so this is a bubbler, and what this does is it creates back pressure to keep the patient's lungs inflated. So what I've done here is I've glued together some PVC parts, and I've drilled a number of 1/8 inch diameter holes in here for the air to come out. So you can mount this onto a bucket or any type of container at all. I just used this glass one for the video so you can see how it works. So what's going to happen is when you exhale, the bubbles come out, and that provides a little bit of breathing resistance on exhalation to help keep the patient's lungs inflated. I've added dishwashing detergent to this water to help kill the virus, but you could also add bleach or other things to the water. This is the exhalation part. Now for the inhalation part, you can use a CPAP machine to provide the pressure, or if you don't have a CPAP machine, you could take a shop vac and combine it with a dimmer switch. I've just used an off-the-shelf extension cord and used the dimmer switch to control the speed of the shop vac. And then what I've done here is I'm going to put this fitting on the end of the shop vac. I've drilled a hole here to let some of the air out because that makes the shop vac able to speed up a little bit while still generating the correct pressure. So I'm just going to tape this up real quick. And then we'll have a shop vac configured to act like a CPAP machine. Now of course you want to use a brand new shop vac, not one that you've used to suck up messes for years, because the worst thing you could do in this project is try to help somebody for one ailment and put bacteria in their lungs from your shop vac and give them another case of bacterial pneumonia. So anyway, this is how this is all going to work. As you can see, we've got a hole, but we also have a pretty good seal with the electrical tape. Okay, so then we're going to attach the fitting here. You can use Teflon tape if you want to. Okay, and then let's attach these fittings to this. Okay, and then you can attach a hose there. And now this is going to connect to the inhalation, which is going to be right over here. When you assemble these things, be sure to hold the fitting and not the mask, because we don't want the fitting to break off from the mask. So there you go. That's our inhalation hooked up to the vacuum. And then our exhalation, we want to capture the exhalation both to provide back pressure in the patient's lungs with the water in the bubbler, and we want to capture the back pressure, capture the exhaled air, because it's going to have virus in it, and we don't want that to go into the caregiver's lungs and give them the disease. Okay, so there you go. Plug it in and fire it up. Okay. Then we can turn it up. Now to adjust the shop vac, we're gonna put the mask on and turn up the pressure till it just starts to bubble. So you can see this keeps the patient's lungs pressurized while they breathe, so there's more surface area to collect oxygen.